Kayhan show. Welcome to our show. Today our subject is malaria. What's the meaning of malaria and the others? I am the patient of him and we're going to start. Yes. What is the meaning of the word malaria?
Malaria is an ancient Roman name. Ancient Roman believes that the reason of the malaria is bad air. But we know that malaria is a big problem in the world and is a disease characterized by recurrent fever, chills, and associated with the synchronized releases of parasites, red blood cells.
What is the reason of malaria?
The main factor is a protozoa, a kind of parasites, genus Plasmodium.
How many types of Plasmodium?
We have 4 types. The bad one is Falciparum and Vivax, and the other 2 is Ovala and Malaria.
Is it a big health problem in this age?
Yes, it's a big problem because in this age, approximately every year, 200 or 300 malaria patients we have, and every year 2 or 3 million deaths after these illnesses.
We know that it's an ancient illness, and in this country, how can we track it and eradicate it?
The main problem is the increasing prevalence of chloroquine, which is the major drug against malaria in Africa. After this chloroquine resistance, too much malaria factor, for example, Plasmodium falciparum especially, invaded easily its region. It's the African location.
Are all mosquitoes the part of it?
We know that the main factor is, the main infection is female mosquitoes, and after biting the human, this Plasmodium goes to the liver and there is reproduction in it. Then it affects the red blood cells.
Are all kind of Plasmodiums behave same?
No. According to this, we divided them in 4 types. Plasmodium falciparum is the most lethal parasite because it can invade red cells of at any age. Plasmodium vivax only invade young red cells. Plasmodium malaria invade only older red cells.
What is the symptoms of it, and what is the main problems in this illness?
The main problem is fever and chills, but we know that it makes a lot of problems. One of them is coma. Cerebral malaria is the most feared complication of Plasmodium falciparum infection, and as the result, it's fatal. Also, during the malaria, you have a lot of hypoglycemia symptoms. Hypoglycemic in Plasmodium falciparum malaria may have at least 3 causes. One is the release of insulin from the pancreas by the gene or quinidine drug treatment. The second one is glucose consumption of the massive numbers of parasites. And the third one is depletion of liver glycogen stones in persons who have not eaten for several days because seeking medical care because they were ill with malaria.
So how can we prevent?
Uh, we can prevention the main health strategy in endemic region. You can eradicate it all mosquitoes, but it's not possible. As the result, we are using drugs about chemoprophylaxis.
What must our treatment nutrition strategy be during malaria or any other chronic illness?
The main factor, the main problem is we use chloroquines, but in the future, in the last years, we know that there's a big resistance developed about the chloroquine. And chloroquine-resistant Plasmodium falciparum is invaded all the part of the all over Africa, and we must give a lot of nutrition to them. During malaria, you have a lot of diarrhea problem, you have fever, you have chills, so your nutrition is too much important. But we mustn't forget that chemoprotection agents are too important. Successful treatment of patients with malaria depends primarily on effective anti-malarial drugs. However, infusion of glucose and serums, it means more liquids, are also important during treatment.
What is ORT?
We use ORT therapy. If you lost a lot of liquids in your body, we develop in World Health Organization with ORT, and we give them to the patients. With the ORT, oral rehydration therapy, the purpose is to treat the deficit in water and electrolytes and some amino acids that occur with acute water diarrhea. It includes amino acids, sodium, potassium, and sugars.
Could we find it easily?
Sure. All World Health Organization in Africa, they easily you can find it. Also, you can produce your ORT with Diet Coke and mineral water easily. It's not same, but in Diet Coke you can take liquid and potassium. Also in mineral water you can take liquid and sodium at the same time. We prefer Diet Coke because if you take normal Coke, there's a lot of glucose and it increases your diarrhea, and you lost a lot of water with this way.
Okay, you talk about probiotics, but we heard the verb prebiotics. What is prebiotics?
Because probiotics are beneficial to the host only when they are present in the gut, therefore requiring frequent oral administration to have a permanent effect. Other mechanisms to manipulate the composition of the gut flora, potentially to increase the growth of bacterial groups like bifidobacteria or lactobacillus, have been tried. And in malaria or all infections, you can use probiotics. But prebiotics, non-digestible food ingredients in humans, are capable of selectively stimulating the growth of activity of one or a limited group of bacterial species in the gut.
You said there is some amino acids in ORT. What is this?
In ORT, we have glutamine, and glutamine is a specific essential amino acid, and it helps your immune system and your body's important nitrogen-carrying amino acid, is one of the principle of metabolic substrate for enterocytes.
Okay, what is micronutrition supplementation in diarrhea and chronic fever illnesses?
First one is zinc. Zinc is important because it increases immune system. If you consume the zinc in your illnesses, is recovered faster, 20%, but it must start during the beginning of the illnesses, especially in 3 days of your illnesses. Zinc increased immune capacity. Second one is vitamin A. Since vitamin A supplementation had a significant impact in reducing diarrhea. Third one is selenium. Selenium improved immune system, we know it. The fourth one is B vitamins. There are a lot of group, in B vitamin, folic acids, thiamines, riboflavins, etc. The most important is folate in malaria because during this malaria, your plasmodium invaded your red blood cells and you have anemia. With this folate, we protect you from anemia. How can you take folate? You can take folate in red, green vegetables easily. If you consume green vegetables, your folate level is up in your body, and it's important cellular growth, including cell-mediated immunity and DNA and protein synthesis.
Okay, in this illness, is there an importance of antioxidants, vitamin C, vitamin E, or another things?
Yes, there's a lot of important in chronic illnesses, also in malaria, because they are antioxidants. Antioxidants protect for damaging by oxygen radical produced by the immune systems. Also, vitamin C is one of the most important antioxidants during all infections. And we know that vitamin C is a water-soluble vitamin, and you can take much more easily. For example, in the literature, we know that approximately 250 gram weight of a rat, they gave 16 milligram C vitamin in one period, and there's nothing in it. There's no toxication of it. It increases body immune systems for protecting illnesses. We know it.
Okay, could you please tell us something about also vitamin A, please?
Vitamin A is too important in your immune system, and especially regulating numerous key biologic processes in the body, including those involved in morphogenesis, growth, maturation, vision, reproduction, immunity, and more broadly cellular differentiation and proliferation throughout life.
Okay, in which foods or fruits can we find vitamin A?
This is a vitamin A is fat-soluble vitamins, and it's important, as before I told about illnesses in immune system. Vitamin A include liver, fish, liver oils, butter, cheese, milk, fat, egg yolk, especially goat milk. Vitamin A include liver, fish, liver oils, butter, cheese, milk, fat, egg yolk, goat milk, dark green leafy vegetables, deeply colored yellow and orange vegetables and fruits, carrot, mango, papaya, yellow sweet potato, pumpkin, apricot.
What about zinc?
Zinc is also easily found in animal proteins and animal products like meat,
But
liver, fish, and etc.
what is the problem during zinc deficiency?
In clinical manifestations of zinc deficiency, there's a lot of illnesses. We know it: growth retardation, hypogonadism, delayed sexual maturation, immunodeficiency, increased infections, delayed wound healing, skin lesions, alopecia, hypospermia, night blindness, diarrhea, and anorexia.
Dr. Kayhan, how can we prevent from mosquitoes?
We do it with chemoprotective agents, with DDT, but this kind of medicines to kill all other environments too, and they are toxic for all plants, all animals, and also for us, because this DDT is invited to the liquids in the soil, and it affects our vegetables, our fruits, and yes, we kill all mosquitoes, and then DDT kill all of us. This is not the way to prevent from mosquitoes. Yes, we find much more humanistic, naturalist treatments and preventive factors in chemistry. We must work much more harder because these toxic agents affects the humans and animals and the plants, and it makes mutations, and it makes our DNA, and it changes our body for the future, and there's new future problems after this kind of preventions.
Okay, after short advertisement, we're going to continue our show. Welcome to our show again. Dr. Kayhan, could you want to talk about any other treatment supports in malaria?
Sure. We know that quinine and the other antibiotics or antiprotozoals, or antiplasmodiums, are too much important for the treatment. But during this period, we forget that our patients' nutrition and our patients' immune systems. We must support their immune systems to fight about this kind of plasmodiums or any other chronic illnesses. This can be easily maybe tuberculosis or HIV, etc. Our immune system is too important, and our immune system's main energy factor is our nutrition. So how can we feed? How can we eat something or drinking something? We know we can fight these enemies easily. So according to this, I'm talking about malaria. You have some main problems. What is these main problems? You don't forget it. You have a lot of fever. You have a lot of chills. You have a lot of diarrhea, and your lost body weight, and also you are tired, real tired because of the fever, and you don't want to eat or drink something. So according to this environment, we must prefer good alternatives.
Probiotics.
Probiotics.
Vitamins.
We talk about approximately 2 programs ago, kefir, yogurt, prebiotics. Why are important? Because you can eat it easily. You know, they are between liquid and solids, and you can swallow easily. And it
And
makes
natural, I think.
and natural, yes. And it with this diet, you can take a lot of proteins, calciums, and carbohydrates, and also fats. This is an easy way to protect your body against the enemies. And also, in Africa, you can easily find all kind of fruit juices. These fruit juices increase your glucose level, your vitamin level, especially vitamin B, C, A, E also. But B, C is important because we know that they are liquid soluble vitamins, and you can take it easily, and it affects you in acute symptoms and acute body protection. This is important. Also, you mustn't forget it. If you drink too much liquids, you must be sure that your liquid is clean.
Yes.
This is important. So if you are any suspicion, please boil your water and then drink it, or make foods from this water. This is an important factor, because you don't forget during malaria, your body immune system is depressed, and we try to increase your and stop this depression and increase your protection, your fighting level about these plasmodiums. Especially, I want to talk about riboflavin and vitamin B groups. They are cofactors in your body, in your immune system, and if you increase it, your immune system starting to be too powerful, to be powerful against this plasmodium. And also vitamin C, same. We don't forget it, also fat soluble vitamins, which one of them is vitamin A, you know, we talk about it, and also the other is vitamin E. But if you take it much more, these vitamins A, E, D, K, you have another problem in your liver, because plasmodium is increased and invaded firstly your liver, and this is a main problem for your body about increasing these plasmodiums. Plasmodiums makes obscures in the blood vessels in your liver, and you have liver problems. With this vitamin A, D, E, K, they are fat-soluble vitamins. They are stored in the liver and makes there's a lot of hepatosteatosis, and it makes your body liver enzymes is increased, and your body feelings, you are tired, and you don't want to be fight against these illnesses. Also, another problem, we use quinines and some antibiotics about this plasmodium, you know, they also stored in your liver.
Okay, you always say that you have to be strong. your body is going to be strong against the illnesses.
Yes.
And you have to make sportive activities.
Yes, sure. Yes. This is important. This is, I believe that if you have a good nutrition and good exercise in your life, this is very strong to be ill, and you are to be strongest in your body. Today, we know that living in the world has some main rules. You mustn't drink alcohol. You mustn't smoke. Also, you must make exercise every time. And also your nutritions, your feeding. Natural feedings. I know I talk about COX before talking in the starting of, but this is a practical way. This is the I don't prefer COX or some gas drinkings because we know that they affects our body also in bad position. But if you need potassium or sodium, you can easily take it from the Coke, and you can buy it from the market easily. This is an easy way to drink it and to stop your electrolyte imbalance. This repair it. On the other hand, there's a lot of minerals in the foods. We talk about zinc, you know, and the other one is iron, iron and copper. They are too important. You can take copper and easy way chocolate. Yes. If you eat two chocolate, you take a lot of coppers.
And you are going to be happy.
Sure, because chocolate affects your medulla systems and makes you happy and increase endorphin and enkephalin also. This is the easy way. Also, there's a lot of calorie in it, you know, and it makes an illnesses in malaria. It's to feed with chocolate, increase your body kilogram. This is good for you also. Another one is also selenium. Selenium is an antioxidant agent, and it protects your body to increase your immune system and to support your immune system because it's a powerful antioxidant agent. Also, we must talk about prebiotics or probiotics. These bacteria easily control your bowels and guts bacterial balances, and it affects your immune system, and also it stops your diarrhea, and it stops your losing some much more liquids from your stool way. Also, during the treatment periods, we must look the way how many in 3 days or in 2 days your chills and fevers is increasing. So you mustn't give nutritions or feedings or fruits or meals it every same day, because you know, if you feel bad, you have you don't want to eat something, but after the fever decreased, you starting to eat or drinking something. This behavioral this behavior of defense system, about body defense system, you must feed the patient according to his problems. Also, we don't forget that in chronic illnesses, their psychology is depressed.
Yes.
So we almost give them psychological support, and we say that it will be good. It will be. This is really increase. This is the placebo effect. Yes. We know, and we know that human is a good power in your body, in your soul, in your body protection. If you give positive support, you will get good results easily. In hospitals, there's a interesting searchings. When a patient go to hospital, he thinks that, or she thinks that, okay, I will be fine. But this is a building only. But this is psychological. We are human. All humans have a psychological factor, and so in a house, we tells every time our patients, you will be fine. It will good. It will be good. This is the easy way to increase immune system in a human body.
Okay. Thank you, Dr. Kayhan. This is the end of our show. We talked about malaria today, and the other program is going to be about, what is this? Tuberculosis and how to feed in tuberculosis. Be healthy and be happy in your life. Goodbye.